Hey chiropractors, Dr. Charlie here with ProCredits. Do you need clinical documentation hours? Well, ProCredits offers many courses on clinical documentation at ProCreditsCE.com. Here's an excerpt from one of those courses. Enjoy.
Soap notes. The most important item to realize about soap notes is you need to document everything that occurs during the encounter. The patient comes in and doesn't say anything, okay. The patient comes in and says, I have numbness in my left pinky only from 10 a.m. to 11:30 a.m. You know, some patients get very specific. Jot everything down. Regardless of the clinical condition or financial arrangement, I need to repeat that. Regardless of the financial arrangement. Why am I saying that? Many doctors do this, and I just don't get it. They'll say, Dr. Marty, I saw a patient. I adjusted the patient's knee, but I didn't write it down because I don't get paid for it by the insurance company. Wrong, terrible, don't do that. Dr. Kotler, I saw a patient and I did manual therapy and an adjustment in the same region, but because I won't get paid for the manual therapy if I do the adjustment, I didn't write down that I did the adjustment. Terrible approach, wrong, bad. The main purpose of documentation is to document the entire encounter. Now, after that encounter is totally documented, then you decide, okay, is this a cash patient? Is this a prepay patient? Is this a Medicare patient? Is this a PI patient? Good quality care involves documenting everything that occurs. It's the only way for you to substantiate that the care you provided was actually performed. And you know you can get asked for your records. The most common is insurance companies, but state boards, malpractice cases, even a patient could ask for a copy of their record. All soap notes must be dated. Make sure you include the year. They must be signed. If you have a CA helping out, putting the hot packs on the patient or setting the patient up on traction, your CA's name or initials need to be entered into the note. I'd say about 70% of the doctors we work with are using software. 30% are still using paper notes, which it's okay. You could still use paper notes, but if you have to make a change, draw a single line through the item, then make your correction. You cannot change, alter, delete your soap notes in any fashion once they've been entered into the record. You can make changes in grammar, in spelling. The notes, they should be completed on the day the patient came in. If you get distracted, you go home, do them the next day. That's part of our compliance manual. The notes must be done within 24 to 48 hours of the patient encounter. Now, patient doesn't show up, or you tell the patient to come in 3 times a week and you notice they're only showing up only like once a week, once every 2 weeks. That should not be ignored. Enter that information into your notes. Patient is not following my schedule of care. Patient is not showing up for our healthcare classes. The patient is not doing the prescribed home care exercises. Very important information to protect you. Protect you, the doctor. Some of you may be older than me. Many of you may be older than me, but I look at all my doctors and all my attendees that come to my seminars and webinars like you're my children and I want to protect you. That's what I'm doing today. I'm putting a coat of armor around your notes to protect you and prevent you from problems and unnecessary stress. Okay, so here we go. SOAP, soap notes. S stands for subjective. Whatever the patient tells you. Dr. Kotler, I have pain in my knee. I also have tingling in my right hip. I also have a headache today that's causing me to see stars and my brain is foggy. I also have, whatever the patient tells you, document. That's why it's called subjective. Whatever the patient says, document. You may or may not agree. You may or may not believe everything. If a patient says, Dr. Kotler, I don't think your care is helping me, and I think I'm going to go see an orthopedist for a second opinion because I think I'm going to have surgery. You may not agree with the patient's approach, but that's something you should document and write down. I think it's a good idea to ask patients about pain on every visit. Dr. Kotler, what do you mean? This is I get pushback or we get questions. I have to ask patients about pain on every visit? Well, okay, so every other visit, okay? I mean, do you want to just totally ignore the pain? Just trying to be logical. When a doctor says, do I have to document pain on every visit? Dr. Kotler, I don't have time. I see like 100 patients a day. I don't have time. My CA doesn't have time to ask the patients about pain on every visit. Okay, do you want to ask about symptom frequency? You know, Mrs. Smith, how you doing? Oh, Dr. Kotler, my neck is killing me. How often do you feel that? Oh, I feel it about 80% of the day. All right, that's constant pain. Subjective, more information. How's it going since the last visit? Medicare makes a big deal about that. You haven't seen the patient in a while? Hey, Joe, how's it going? Doc, yeah, it's been a while. It's been about 9 months since I've seen you. Anything different since I last seen you, Joe? No, Doc, my back is bothering me. And then I lift up the patient's shirt. Look at the photo in the bottom right corner. You see that huge scar? Joe, what is this scar on your lower back? Oh, yeah, Dr. Kotler, I forgot to tell you. I had back surgery since I last saw you. Right? Patients, they sometimes forget to share very important information. And sometimes patients are very willing to share. Like Dr. Kotler, when I first came in, you remember, I couldn't even get out of a chair. Look at me now, and the patient pops out of the chair. I love that. Document that. How's it going with the exercises? Document that. Objective findings. Straightforward. Whatever you find. High right shoulder, short left leg, subluxations, restricted motion, poor posture, inflammation, tenderness, trigger points, forward head carriage, upper cross syndrome, abnormal rotation, hypermobility, muscle ropiness. Go for it. Range of motion. You want to get very, very, very specific in your notes and you want to score certain things? Would you like to score or grade the tenderness scale? Go right ahead if you would like. Could only help, can't hurt. It's going to take more time, but it'll be better than nothing. You ever palpate a patient and they jump? They aren't unable to sustain any pressure. It's grade 4. After 12 visits, the patient is a grade 3 or a 2. Muscle strength, patient starts off on day 1 as a 3, then after 12 visits, they're a 4. After 24 visits, they're a 5. So you could use scales and scores to put in your SOAP notes and monitor progress. Then we have the A for assessment. This seems to cause confusion, or many doctors, they just don't know what to put in the A for assessment. So I'm going to share this with you right now. I'm going to give you a few examples. You know, in some software programs under the A, the diagnosis codes just get listed. Just to share with you, an assessment is not a diagnosis. A diagnosis is not an assessment. So just listing diagnosis codes in the assessment doesn't make sense to me. So as far as the assessment goes, report any significant changes to the short or long-term goals, document recommendations for additional testing, describe any significant changes in each goal, assessment of improvement, plans for continued treatment, or anticipated discharge. Is the patient reaching the goal? Are the present diagnosis codes still appropriate? Are the present CPT codes still appropriate? If the patient comes in upon re-exam and they don't have neck pain anymore, then you shouldn't be reporting neck pain anymore. So update the diagnosis codes. Assessment examples. Here we go. Patient is now able to put on socks and shoes without assistance. Patient's ability to sit at a computer is now up to 45 minutes without pain. Originally, it was only 10 minutes. Patient is not responding well to care, will be sent for additional testing. Patient has responded very well to care and will be discharged from active treatment next week. I think that's a few good examples. Home care instructions, yes. Give patients instructions on home care. You're going to tell them how much, you're going to tell them to use ice? Get specific, how much to use, where to use it, how long to use it. Most of you should be giving patients exercises to do at home. Include details, specific number of repetitions, the sets to be performed. Provide exercise sheets and handouts to the patient. Have the patient sign and date the forms you give them. Give a copy to the patient. You keep the original. And then we have P for plan. This is your opportunity to document everything that you did, everything that was done. Example, adjusted L4, L5, ultrasound, 15 minutes to the right upper trapezius, therapeutic exercises, lumbar region, 15 minutes. So those are the basic items you can put in your plan. Now, some of you have been put on prepayment audits. Some of you are involved with post-payment audits. Some of you have state board issues, and those particular situations will require the doctor to document more better, document more information. I'll show you examples in a couple of minutes, but you may be required due to the audit to write down the specific device settings, the name of the equipment manufacturer, the name of the muscles that you're directing the therapeutic exercises to. That's why I mentioned earlier in the program, if you're going to be doing therapeutic exercises in the neck or the lower back, list the specific muscles. Another thing, in your notes, if you adjust, let's say, an extremity, I do not recommend you write adjusted shoulder. To begin with, which side? Even if you write adjusted right shoulder, it's not enough. The shoulder has a lot of structures. Did you adjust the humerus, the AC joint, acromioclavicular joint? Did you adjust the scapula? What did you adjust? Write down the specifics. If applicable, and the note, patient tolerated the treatment well, and the treatment was without incident. Now, you probably know this already, but your notes cannot look the same on every visit. I did a spot check recently on one of my clients. The first visit was good. Day 2, second visit, good. Days 3, visits 3 through 11 were exactly the same, verbatim. Nothing was different. The only thing was different was the date. The notes cannot look the same on every visit. It leads to poor documentation, bad